Hello everyone. Today we are going to discuss about the topic skin turgor. This is me, Jancy Mary, working as a tutor at Triple M College of Nursing. So let's dive into the topic. Objectives. At the end of the lecture, the listeners will be able to explain the purposes, sites, procedural steps, and also what is the nurse's responsibility. So it is simple but important assessment used to check the hydration status of the patient. So skin turgor is nothing but the elasticity of the skin, ability of the skin to return to normal after being pinched, and indicates hydration status. So skin turgor refers to the elasticity of the skin. When we pinch the skin and release it, it should quickly return to its normal position. This helps us assess the dehydration. What are the purposes? Skin turgor is mainly used to detect dehydration. It is especially important in children, so elderly patients and patients with vomiting and diarrhea. What are the common sites? In adults, we usually check the skin turgor on the forearm or below the clavicle. In elderly patients, skin elasticity reduces naturally, so we check over the sternum. So in adults, we usually check skin turgor on the forearm or below the clavicle, as I told you, and also the glabella, sternum in elderly patients. So we'll see what are the procedural steps. Explain the procedure to the patient. Wash your hands. Gently pinch, as shown here. Gently pinch between the thumb and the forefinger. Lift the skin for a few seconds and release and observe. The skin fold persists after a pinch and then release. Interpretation. If the skin returns immediately, hydration is normal, and if it remains tented or returns slowly, it indicates dehydration. Support skin turgor, it returns slowly, and normal, it quickly returns back to its normal state. That is the interpretation. Moving on to the causes of poor skin turgor. Poor skin turgor usually indicates dehydration, as I told you earlier. So it may also be seen in patients with burns or malnutrition. Also, severe diarrhea and vomiting patients. Moving on to the special considerations. So who all require special consideration in this matter? In elderly patients especially, skin loses its elasticity naturally. So we should not depend only on the skin turgor. Check other signs like whether they have the dry mouth, low urine output, or also you can check for the vital signs to know whether the person is normal. Okay, so always assess the other signs also to rely on the elderly patient's skin turgor, whether they are hydrated or dehydrated. Okay, how do we check in children? In children, we are supposed to check the abdomen, and we can also see the sunken eyes, and also the normal fontanelle will be like this, sunken fontanelle. There will be a depressed fontanelle. There will be a sunken fontanelle. So in children, dehydration can be very severe. We check skin turgor on all these three sides. Okay. So, moving on to the nurse's responsibility. What are we supposed to do as nurses? Monitor the hydration status, record the findings, encourage oral fluids, report severe dehydration, and monitor intake and output. So, encourage fluids if allowed and report severe signs immediately to the physicians. Okay, to conclude, skin turgor is a simple but quick assessment for dehydration. However, it should be combined with other clinical signs such as elasticity, immediate return of the normal and poor slow return, tenting. Also, it is important to check in the children and the elderly for the skin turgor. Hope you understood this topic. Thank you.